All right, good morning, everybody. Thank you for joining us for the Rise of Fentanyl. Sergeant Tommy Morga is going to be teaching this. Sorry, Tommy, and Ricky Seacrest. Tommy is with the Counter Drug Task Force. He and Ricky both are, and he is assigned to HIDA with Shelley Mowry. They're working closely together to get this toolkit out to as many as possible. Before I hand this off to Tommy, though, I am going to ask Shayna, our evaluator, to go ahead and jump on and give us information on the surveys.
All right, good morning, everyone. It's just like the other ones. We're going to continue data collection with the original surveys for the rest of this fiscal year so we don't contaminate data collection. Starting September 30th, there's going to be new links, new QR codes, and new paper versions for everybody. But again, it's really important that you know that for between now and September 29th, you're going to use the same existing ones that we've been using. And then starting September 30th, there will be a new suite of tools for you all to use, and we'll send out a memo about it. Okay, that's it on my end, unless there's any questions.
All right, thank you, Shayna. Appreciate it so much. All right, hi guys. Kind of like this last week for the ones that were here, and for the ones that were not here, I wanted to do a quick rundown of how this is going to work. I think last week we had a lot of success doing it. What we did was, if you're not familiar with the presentation, what we're going to do is I'm going to present it as just presenting to an audience, right? And then afterwards, we're going to set up everybody into breakout rooms, and that's what Ricky will be doing. And what we're gonna have everybody do is give you guys about 15 to 20 minutes. Make sure you download the presentation from the toolkit. Ricky actually put the link in the chat. So once you have that and you're in your breakout rooms, give you guys about 15, 20 minutes, review your assigned slides. And then however you guys want to present those slides in order, we'll do that. So there's about 40 slides in the presentation. And then what we'll have everybody do is, group one will be, 1 through 5 or whatever. You can have one person do the first slide, come in an intro, next person take over, and so on and so forth. And just it flowed. It ended up kind of happened organically last week, but it ended up working out really, really well. So that's what we're going to do. Should be about roughly around 2 hours, no later than 2 hours from start to finish. And yeah, if there are any questions before we get started, let me know real quick, and then if not, we'll get started. All right, nothing is heard, so I'm gonna go ahead and start up, share my screen, get going, and we'll start it out. Everybody see the screen? Right, good. All right. Good morning, everyone. Thank you for attending today's training. We are going to be talking about the rise of fentanyl is the presentation today, and some of the dangers that come along with fentanyl. Some people may be familiar with it, may have heard it on the news. It is getting more popular in the national news as well, but definitely here in Arizona, we're seeing it. It's happening. It's here, right? And we want to make sure that we are addressing everybody and giving people as much information as possible. So that way we are having those conversations with our kiddos and trying to keep as many people as safe as possible. That is the ultimate goal here, okay? All right, fentanyl, right? It is here. I just mentioned it, and it's all over the place. It's not just in one county. It's in every single county. We're seeing it. There's seizures are happening all the time. All right, and there are task force out there that are working diligently to take these drugs off the streets. And so again, you can see a lot of articles that are out there. Please, do some homework and look around and see. Also, there's also information on the ADHS dashboard that you're able to get information as well. So you can see here is 95% of overdoses in children 17 and under caused by fentanyl poisoning. Okay, that number is very, very high. All right, you're talking about, and we're gonna use poisoning in today's lesson a lot. You're gonna hear me use that term a lot as opposed to overdoses, because a lot of the times that these overdoses are happening, they don't know that they're actually taking fentanyl. So they're actually kind of, you know, quote unquote, being more poisoned as opposed to actually knowing what they're taking, because there are so many illicit drugs out there. And that's what we want to focus on today, and really getting some of that information out there. All right. And we have a quick story.
Isaiah was 15. He was in the middle of his sophomore year in high school. He just had this light about him. I get notification from a family member that there's a picture of Isaiah passed out. They're saying that he took a pill. You know, he went to go lay down and he just wouldn't get back up. We're pretty sure that your son ingested fentanyl, and they're telling me he's not gonna make it. And I just told him, like, you know, I love you no matter what. And you didn't deserve this.
Learn more at talknowaz.com.
Yeah, and unfortunately, there's a lot of more stories like that, right? I mean, it's just one of those things that we need to, again, make many people as aware as possible of the dangers of this drug. Okay, there's a few items that we're gonna be talking about today. All right, what exactly is fentanyl? Okay, because you know, some people just kind of, they hear that term and they think, all right, we know it's bad, but what exactly is it? And also, how big is the problem? Which I feel like the reason why we're all here, for the most part, we know that's a big problem. Okay, it is very high on the list. Actually, number one for the drug threat here in the state of Arizona. Okay, and also, what can we do? We know what resources are in place. What, you know, what is as parents, what can we do to help out our kids going forward? Okay, fentanyl. It actually is an opioid. Okay, that's one thing that sometimes people hear is you know, that may not understand that it actually is an opioid. It is actually prescribed by doctors, and it's, you know, for given to moderate to usually severe pain. Is also used in anesthesiology or anesthesias for surgeries. And so again, it is a prescribed opioid, prescribed medication. But the problem is that we'll actually we'll be focusing on a lot is the illegal part of it. And the illicit fentanyl that's out there. So you can see some examples of other, you know, for other medications. You have obviously oxycodone, you know, Vicodin, fentanyl, morphine. But the thing is, the scary part about this is a lot of these pills are actually disguised as Vicodin, as oxycodone. All right, and that's the Xanax bars. That's one thing we're going to show here in a little bit. And that is what's unfortunately getting a lot of our kiddos. Then you also have the illegal fentanyl, right? The synthetic made, which is 50 to 100 times more powerful than heroin and morphine. This stuff is highly addictive, highly addictive. Kids are going back and getting more. If they you know, they're getting it, they're getting hooked on it, and the drug dealers know about it, and that's what we're here. Okay, then you have the illegal fentanyl, which is obviously sold for its heroin-like effect. Is that euphoric effect, and they get addicted to it very easily. And again, that's why we're here, right? And then also you have the heroin. Obviously we know about that. Heroin is very highly addictive. It is another illegal opioid, and it comes in all sorts of different forms. You can see the comparison right there. And we all know how small a penny is, right? But look at that little, right there in the yellow circle, the amount that it takes is usually right around 10 to 12 grains of salt size to be a deadly dose of fentanyl. And that's how scary, and that's how unsafe this stuff is. All right, but what does this actually fentanyl look like? So you have prescribed fentanyl, you have patches, you actually have pills, and you have obviously that the way that anesthesiologists would use it in surgeries. But then now you have the illegal fentanyl, okay? You have the powder form, okay? You have the pills, you have the disguised pills. You know, you can't, it's so hard to tell which is which. And the thing is too, it's being put in everything. It's not being put just in pill form. It's being put in cocaine. It's being put in vapes, all right? It's being, you know, there's been people that have actually just got, you know, powder touched on, you know, a $1 bill that might have some powder on it that had been, you know, got some effects from it. That it's everywhere, unfortunately, and we just gotta make sure we're aware of that. So what are the most common forms of it? Okay, like I said earlier, it comes in a form of a prescription pill. It looks like something that you would get from your doctor. All right. It looks like those, the M30 pills we're so used to seeing all over. And we've been trying to do as good of a job as we possibly can to make people aware of that. But now the drug dealers they're aware of that. They understand that. And guess what? Now they've added a little twist to it. They've actually added quote unquote rainbows or Skittles, and these pastel pills here that you'll see on the right-hand side of your screen is a recent bust by Phoenix PD. And it's not just in Phoenix that are seeing it. We're seeing it all over the state. And it's getting more and more out there. The drug dealers know about it. They're like, all right, well, there's a lot of heat on the blues. Let's just add a little color to it and change it up. And if you saw that from afar, and there wasn't a Phoenix PD patch around that, you would think that's just a bag of candy. And guess what? There's gonna be little kids that will be seeing that, and that's exactly what they're gonna think as well. Okay, that's how scary this stuff is. People are getting it everywhere. And we just have to, again, be very cognitive of what's out there. It's not just the blue pills anymore, and it's not just in the other disguised prescription pills. Some of the street names, you'll see obviously M30s, blues. So last week we kind of went over a few through the Snapchat presentation. Some of the acronyms you'll see out there. And so again, that's another really good training. If you haven't not had that Snapchat training, you will hear and see some of the lingo, some of the emojis that are used for some of these prescription drugs. So you'll see right there for blues, obviously the blue M30 pills, the rainbows and Skittles, some of the pastel colors that we just saw on the last screen. Those are some of the street names you'll see used on social media. Also, you see Friend, Goodfellas, Jackpot, Tango and Cash. There's some of the names that are being used. But again, just kind of do your homework and be aware of what's out there. How are the pills used? Okay, obviously the easy way is just swallow them, right? But it's not the only way that they're being used. They're snorting them, they're crushing them up, snorting them in line, just like cocaine. They're smoking them, so be very cognitive. If you see tinfoil around the house, around schools, we've been hearing stories about finding tinfoil in bathrooms in schools. So we're hearing stories about that as well. And then also they're injecting it just like heroin, okay, because it has the same sort of effect as a heroin. That's how strong the stuff is. And how big is the problem? I think we all know is pretty big, right? And that's why we're all here. But fentanyl is, like I said earlier, the #1 substance found in fatal overdoses. Okay, in 2020, nearly 2 out of 3 overdoses involved fentanyl. Okay, it's almost impossible now to hear about a drug overdose that did not have fentanyl in it. It's getting that common because the pills that are out there, they're not being manufactured properly. There's no dosage in some of these pills that are on these streets, and we're going to talk about that. So why is this occurring? All right. Counterfeit pill seizures. I mean, you can see right there from 2018 when it was uncommon, very low seizure numbers, right? It wasn't that high. But now here we are 4 years later. Let's look at the number right there, fiscal year of 21. We're over 12 million pills that are being seized. And we're higher than that now. Some of the DEA and some of these initiatives that are out there that are taking these drugs off the streets, they're seizing pills in 1.5, 2 million pills at a time. So that number is going to climb in 2020, especially now that we have the new colored pills that are out there. All right. So, I mean, they're everywhere, and it's very, very scary. We have to make sure we understand that. Again, there's a 100% increase in counterfeit pill seizures from the time it started to where it's at now. It's real bad. So be aware, right? What do they look like? And also another thing too to keep in the back of your mind, these pills, these M30 pills, they're not very big. This pill, you can see this picture here, it looks like a normal aspirin, right? Something that you see in a big, white aspirin bottle, or that you see off the shelves. These pills are small. Okay, they're no bigger than the eraser on this pencil here. All right, or the straw, or the tip of your straw. And kids can hide these things in 100 pills or so in their pocket, and you wouldn't even know they're even there. All right, that's how small these pills are, and you have to make sure you understand that.
Teens like me are dying from fentanyl poisoning. I know because I lost my brother Alex to one pill made with fentanyl. Alex didn't know the dangers of fentanyl and that one pill can kill. It can happen to anyone, and it changes everything. These pills look like they come from a pharmacy, but they don't. They're fake. Drug dealers on social media are not your friend. They take your friends. They took my brother. Don't let them take you. Fentanyl can end it all.
And that was actually a PSA that we had that was done by Amy Neville's daughter. I know Amy's on the screen, so thank you, Amy, for allowing your daughter to do that. Again, and some of these, and as a matter of fact, these PSAs are all over the place. They're going to be in you're going to see them in Harkins. You're going to see them on YouTube. As a matter of fact, we just heard that yesterday that someone actually saw that PSA on YouTube. So we're trying to get the message out there as much as we possibly can, the dangers of this drug. But we're going to talk about, we obviously know the dangers of it, but we also have to talk about what is the driving force behind these drugs. Okay, why are the kids taking these things, and what's their goal here? Okay, they're curious. Some of these kids, they're just curious about how I want to have the feeling of being high. I don't know what it is. I know my friends are doing it. They're having a good time, and I just want to feel that, right? Also stress. They know that something. They're dealing with stresses at home. They're dealing with stresses at school. And yes, these kids do have stressors. A lot of times we sometimes feel as parents like, oh, we have a stress in our lives, from work or from, family or whatever the case may be. But these kids are under stress as well. We have to be aware of that. And sometimes if we're not talking to them about those stressors, they're gonna go find it. They're gonna go talk to their friends. And sometimes their friends may be the ones that are, hey, just take this little pill and it's gonna make you super happy. And that's what we have to make sure we're aware of, because they may, hey, you know what? It did make me happy. I love the way I feel when I took that pill. And the next thing you know, they're hooked on it and could possibly lose their life because they got depending on those pills. And you see right there in the last one, obviously the dependence, right? They're going to get dependent on it if they get hooked on it. So is your child, let's talk about some of the risk factors that you may see. So family history of substance use, right? Are the kiddos seeing, are the parents in and out of, rehab? Are they getting help themselves? Are they seeing pills laid over on the counters, on the tables? So they actually see, they see it firsthand, okay? Or they may be also diagnosed with or undiagnosed with mental health issues, and they don't know how to address it. So they may say, they may be depressed, or have anxiety, and again, they don't know how to deal with it. They may not have the resources to get to somebody, to talk to somebody. Their only resource is their buddy, and their buddy is the one that's selling those drugs. And that's what we have to make sure we're aware of. And traumatic events, okay, those are very scary, because what's traumatic to one person may not be traumatic to another person. But again, you have to understand what those kids are going through, what they may have saw. They may have seen their, friends be in a car accident, or they may have been in a car accident. Okay. Or seen something, something worse on top of all that. And then also just impose control, right? Kids are gonna do kids things, right? We've heard that term all the time. I have a little 2-year-old that likes to jump off the second step of the stairs. I get worried, but he's pumped. So that's only going to build over time with some of these kids. They want to try things. They're going to take risks. They're like, oh, you know what? I took it one time. I had a good time on it. We're going to take it again. So having that control, you have to be cognizant of that. And of course, we're increase the risk of substance use across the board here. All right, so what can we do? All right, that's what we're here. We're trying to get some good training, and that's what we're here. That's what we're here to do. Okay, obviously, you can start with prevention, right? Making healthy choices, being in good situations, talking to our kids, talking to them early about drugs, making them aware that not all kids are taking these drugs either. It's not the norm, right? We're trying to make sure we are targeting the ones that are. And we have to make our kiddos aware of that. Screening interventions, right? Identifying those in need and trying to take action. Overdose prevention, understanding what naloxone is. If you don't know what naloxone is, we have trainings on that as well. So try to reach out to somebody or to your closest coalition or they may be working with and get some training on that, and also get it in your house. We're trying to make naloxone just as normalized as as Tylenol to have in your house. It's safe. It only does one thing. Reversing overdose. Again, it's not that scary to have it in your house. And some people think it is big. Oh, I don't need that stuff in my house. I don't want it in my house. It's just a stigma behind it. But it's good. And to carry it, right? Carry in cars. Obviously there's a temperature gauge or barrier on those. So if it's obviously too hot here in Arizona, it can actually, not work properly. But most SROs will be carrying it at schools, and nurses will be carrying it as well. All that, finding help, right? Treatment works, right? Recovery is possible, right? That's why they're in place. So reach out and definitely call people if it gets to that point. So what can we do, right? Again, I said earlier, talk early, talk often. Okay, offer guidance. These kids will look up to you. You're the parents. All right, you're the guardians. They do respect you. They may push back a little bit on some items, but you have to just staying strong and offer guidance and advice on some of these things. Okay, set limits that you can live with. You obviously don't want to push the kids too much. I think we all know that, because again, the kids will push back. But setting that good limit that you guys are both comfortable with. All right, show concern rather than anger. Sometimes when we just get so angry at our kids and we yell and yell and yell, it just clicks, and they just turn off their minds, and they're not after that point they're not listening anymore. So actually having a conversation with them, having an adult conversation with them as well, right? Some of the kids that we're seeing, they might be like 13, 14 years old. They know what's going on. We want to make aware and have those hard conversations with them, and ask those open-ended questions. Okay, tell me about your night. How where were you at? What were you doing? Things like that. Is ask them open-ended questions, kind of guide those conversations as you go along. And again, work to understand your teen's point of view. I said earlier, the kids will push back. They have thoughts, right? I think the days of me growing up, it was my parents' view, and that's all I saw, right? It was me, I had to shut my mouth. But that's not good parenting, honestly. That's not the way we want to go about our lives. We want to make sure we're understanding our kids, we're listening to our kids, and we're getting their point of view. Okay, there's smart kiddos out there, and they have an opinion, and we want to make sure we're get on the same wavelength as them. And establish a rescue plan. If you don't know what a rescue plan is, have something in place to where if they are out, you have a code word or something on your phone that they can text you to say, hey, the sky is blue. That means there's stuff around me that I don't want to be here. Can you come get me? They can drop a pin where they're at, have some sort of rescue plan in place to help the kiddos get out of the situation they may not be comfortable being in. Because like I said earlier, not all kids are doing drugs. Not like every single kid in the state of Arizona is doing drugs, but they may be around their friends and they may not be comfortable doing it. Social media, we talked about social media with Snapchat and things like that, right? So we want to make sure we're monitoring our social media. Take notes of what social media sites that they're on, that the kiddos are on. We do also have, we actually have like phone contracts that you can reach out to us, and we'll actually get some of those contracts for you. And what they're just saying is, how much usage can they get out of their phones? You're paying for the phones, okay? Until they take over their phone payment, they're 18 years old, you are in charge of their phones. I guess sometimes we don't want to invade our kids' privacy, but especially when it comes to social media, they don't know who they're talking to a lot of the times. So we want to make sure of what sites are going on, and also keep tracking of their username and passwords. Okay, I'm not saying go in there every single time and log in every single one and all right, who are you talking to? What are you doing? But keep track. So if there's ever any suspicion, you have that usage. Set limits, right? That can be part of the contract. Set a limit time of online time. scrolling time, YouTube time, or just time on some of these websites or some of these social media sites, because they can spend hours on these things, and they will spend hours on these things. So setting that limit could possibly honestly limit is who they're reaching out to as well. Again, talk with them about what they're seeing, what they're posting, because they can easily go through some of the stories. I know on Snapchat particularly, there are stories that will be put out there, and there's people that are selling drugs, selling guns, flashing wads of money, just to kind of attract people in, right? That's the whole idea behind that story. All right. Another thing too, so offer, again, if there are kids that may be going through some pain, right? Maybe a post-surgery, wisdom teeth, something like that, maybe some sort of sports injury, offer alternative modes of management. Okay, obviously Motrin for inflammation, obviously Advil, I believe Tylenol for just pain management. There are one-shots you can actually get, obviously under doctor supervision, and physical therapy and massages. Okay, making your kids aware there are other things you can do besides just taking one pill to get rid of your pain. All right, actually, and it's a better way of doing things, right? As far as staying fit, that could be part of it as well, is trying to manage that pain. And so that's one of the things we want to make sure that they're aware of. It's not just take a pill and let's just move on with our lives, right? There's things that you can actually do to better yourself. And if you do have any medications in your house, okay, secure them, right? Put them in a safe. There are lock boxes that are out there, making sure that they're stored properly. And they're at even at elevation that are high enough to get away from some of the kids. Like a two-year-old. Again, I have a 2-year-old. All my stuff is make sure it's stored high that he can't get to it. All right. But again, also, if you do have prescription drugs that are just sitting around, in a count or on the counter or a drawer or a medicine cabinet, and they're expired and they're just sitting there, get rid of them. All right. Dumpthedrugs.org, a location for drop boxes. Also, every October and every April, we do DEA does a national drug take back. Okay, you can, no questions asked, drop off your medications and walk away. So this here is actually, you're going to see a conversation between two teenagers. All right, and this was a real conversation. And it's just how fast it can escalate when someone's in pain and they don't know how to they don't know how to deal with it, or they're going to reach out to their friends a lot of the time. That's why we talk early, talk often. We want to make sure that our kiddos are talking to us. All right. You see right here, I took perks and fentanyl, and now I can't breathe. Scared to go to jail, and I don't, please don't tell. So this person here is trying to get them to, hey, go talk to your mom. Something that show this person knew something was going on. Okay, you have a lot to lose, and the person can't breathe. They're showing right there that they're right there through a text message. You can see that this is scary. All right, and a lot of times that kids are, and we're talking about here in a second, kids are afraid to call for help because they think they're going to get in trouble. Like you said in the second bullet there. I don't want to go back to jail. They think, hey, call the cops, I don't go back to jail. So they're taking that risk of not calling help. All right. But there is actually something in place called the Good Samaritan Law, where if you see in a sec, that it protects the kids from calling for help. If there's any sort of substances that are around there, they won't be in trouble. And that's one thing that we need to get out there, because kids don't realize that. And a lot of the times when they are doing these drugs, they're usually doing it with another person, right? Not all the time. They're not always doing it by themselves. You see a good video here, talk about the Good Samaritan Law.
I'm Deborah Black. I'm here to ask for your help to save lives during this opioid crisis. Individuals who have overdosed are being left to die because those around them are afraid to call for help. Arizona's Good Samaritan Law protects those who call 911 when they are present during an overdose. On behalf of law enforcement, please make that emergency call. You will not be arrested. You plus naloxone are a combination that will save lives in Arizona.
Yeah, now just thinking about now that I hear that, just go look back on this conversation that it was, just had. If that person, even the person that was texting, it was actually a girl that was actually going through this, that was needing the help, and if her friend would just called and helped, possibly could have saved that life. All right, and that's why we need to ensure that we're letting people know about the Good Samaritan Law. All right, but also know the signs. Okay, not all of us are medically trained, so we may not know what we're looking for. Okay, so understand the signs of an overdose. All right, you're gonna hear some definitely deep sleeping, hard to wake up, heavy snoring, some possible vomiting. Okay, slow and shallow breathing. What that kind of looks like is just, obviously it's slow breathing, but it's not that full breath that you'll see somebody if they're typically sleeping. Sometimes you'll see their chest rise and fall very easily. You may not see that. They may be breathing, but it'll be a very just small breathing. Obviously the snoring, we talked about that. And it can be pale blue, gray lips, fingernails and skin, getting pale, kind of cool and clammy type of feeling as well in their hands. So make sure you're checking that as well. And the cool clammy skin. And just like we said earlier, right? The naloxone, you cannot, when it comes to naloxone, it only does one thing, right? And it reverses an overdose. It blocks the opioid receptors in the brain and allows the person to start breathing again. There, you can see in the box in the top right corner, the nasal spray right there. There's actually 2 of those doses in that box. Okay, if one does not work, you're able to wait a couple minutes and administer another one. If let's say they may not even be overdose, it's safe enough to give to somebody and it won't affect them. I can take it right now and it wouldn't affect me besides having some water up my nose. Okay, again, because it only does one thing, and it's very safe. It's very safe to give. It's very safe to give to even to infants. All right, I remember seeing a recent case here in Phoenix that the emergency providers had to give naloxone to an infant because they actually touched some fentanyl that the parents had on the table. All right, and it worked, and it brought that kiddo back. Okay, again, save a life, carry naloxone. All right, it's safe to have. Normalize it. Put it in your first aid kits. It's always really good to have. Another quick story here to kind of to show that naloxone does work.
If this can be assistance to even the one person, that's what it's about. It's not about me. It's not about John Crow. But I did do drugs. I did overdose. I did get a second chance by the help of Narcan, paramedics, police officers. I lost nursing school. I was homeless. I had nothing. Now I have a house. I have a job. I have beautiful connections. I love the Lord. That's where I'm at now.
All right. So again, the stuff works. Okay, and this person was able to get a second chance, and that's why we want to make sure that our kids are young, carrying it and being ready, because we want to make sure that they try to hopefully get that second chance as well, like this guy got. Okay. Is your child using opioids, counterfeit pills? Okay. If they are, this is some of the effects that you may see in them. All right, the kind of going through that withdrawal, the body aches, they start building up a tolerance for it. Once they stop using it, start having that withdrawal, the diarrhea, a few signs and symptoms to look out for, because then you'll know, like, what's going on. Are you sick? You have the flu? You don't have a temperature or anything, but what's going on here? And if you're not aware of some of these signs and symptoms, please do your homework and be aware of some of these things. All right. And see the very last one there, the emotional withdrawal can last for months. All right. This isn't something like, oh, you get through it for a week and you're good to go. No, it's going to take time. It's going to take work. Ensure, and again, first thing, ensure their safety. Okay, ensure that's all safety first. When it comes to these opioids, get your child an evaluation. Okay, if you once if they obviously if they come back from an overdose, or that they're using regularly, all right, get them evaluated and then suggest treatment. All right, again, have that hard conversation with their kiddos. And the change talk. Okay, so what change talk is just knowing, you can see right there, I'm really feeling depressed, and I don't have decent grades. Okay, instead of getting angry at them and say, well, increase your grades, suck it up, and study more. All right, have that conversation with them. Say, I know what you've been saying. You want to get better grades for some time now. What do you think what do you think is getting in the way of that? Okay, maybe then that's where it opens up that conversation. Well, XYZ person said this or that, or I'm feeling this way, or maybe, hey, I have been taking some pills and it's really affecting my my thinking. So that's where that conversation piece really comes into play. Here's another example. Right, I think I really upset my boyfriend and girlfriend last night when I was out of it. Okay, well, what are your thoughts about the impact of relationship with your boyfriend or girlfriend? Again, just having that open conversation, the open dialogue with the kiddos is very important. All right, so here's some good resources we're going to talk about here going forward regarding treatment. You have the opioid assistance and response line. Okay, but seeking treatment, ask questions. There's always support out there. The treatment ebook, continuing care, helping parents and caregivers, a partnership to end addiction. You have a text line right here where you can have somebody texting you right away. And there is support out there. It's not nobody's alone, and that sometimes the parents don't realize, like, oh, I don't have the resources. I don't know what to do, and that's what this here. There are resources out there for parents in these situations. Parent coaching, okay, offering peer-to-peer support. There's parents that have that are there to help. They're ready to help. And again, just to ensure that it's out there. Some Arizona resources we have obviously the Good Samaritan Law. Naloxoneaz.com is a good area or website to go to find a distribution site for naloxone. You can go through your insurance to get it at pharmacies. If you just walk into a pharmacy to try to pay for it, it can get pricey. But there are locations all over the state. We have a lot of great partnerships with our coalitions that are distributing it, and you get some good information and training through them as well. Here's some other resources as well. So Talk Now AZ, we talked about Naloxone AZ and opioid OD. And that concludes it. If anybody has any questions, please let me know. But if not, I want to thank you guys for attending the training. I hope you're able to get something out of it, at least be familiar now of how dangerous fentanyl is. And the kids they're getting it. It's all around us, unfortunately. So we have to make sure we try to do our best to, just educate our kids and talk with them, and please talk often with them. And again, if you're able to get your hands on naloxone, keep it around. We want to make sure that it's getting normalized as much as possible. All right. Other than that, I don't have anything else. And that concludes the training. Thank you. Yep. All right. Are there any questions before we get started at all? So again, I just wanted to kind of just teach it as is. Everybody has going to, the cool thing about this is that it's, you can kind of make it your own, right? Keep sticking with the, I almost ended the meeting. Add your little flair to it that you want to. Again, but sticking with the facts that are on the actual presentation themselves. So what we're going to do now is give you guys till it's 9:41 right now is what I have. Ricky is going to put everybody into breakout rooms. Let's give you guys 20 minutes make sure you download the presentation. It should be in the chat. If you don't have it already, we have made improvements to it, or updates to it, I should say, especially with the new color pills. Okay, so that is actually in there. So again, let's give you guys about 10 o'clock, review your slides within your groups, talk about it. I'm gonna hop around different groups. If there's any questions whatsoever, please let me know. And yeah, then we'll go ahead and get started. And then we'll start slide 1 right around that 10 o'clock time. All right, thank you.
Tommy,
Yes, ma'am.
will Ricky be letting each group know what
Yeah,
slides
so
they're
she's just
getting?
getting ready to do it right now. So bam, right there.
Perfect.
So all you have to do now is go in and they should be assigned their rooms. And I just made Vinny a co-host right now. Sorry, I didn't get a chance to see him earlier.
Not a problem. Thank you.
Sergeant Gunderson, good morning, sir. Thank you for attending. We did not put you in a breakout room unless you want to be in a breakout room. And did you put him in the breakout room or he just leave? Okay. Jill and Claudia, do you guys see the breakout room assigned to you guys? Are you guys able to attend the breakout room and for the teach back?
Hey, I just want to say bye. I can't stick around for the whole training, but I appreciate it.
Okay, Amy, thank you again so much.
We'll see you again.
Do me a favor. Can you put in the chat or just shoot me a private message on here, your email? I want to make sure, I want to reach out to you about some stuff for the Snapchat presentation.
Yeah, you got it.
Thank you, Amy. Appreciate it.
Bye.
Bye.
meeting is being recorded.
All right, get everybody back. Let's see, we got. Hello, hello. Chief Freeze, sir, it's always good to see you. Jim, how are you, sir? I see
Thank
you.
you.
How's
Good.
everybody doing?
Doing well.
Good. All right, so I think we have close to everybody back. All right, so again, for the ones that were not here last week for the Snapchat presentation, what we're gonna do is I'll share my screen and I'll control the slides. That way it's easier for you guys. That way all you guys got to do is talk. If you do have downloaded the presentation and you want to use kind of the script or kind of do whatever to kind of stay on task, that's fine. I'll have the one where everybody sees it. I'll follow along with you. If for some reason there's like an awkward pause and you want to hit next screen and I don't change the screens, just hit next slide or just tell me next slide and I'll control the slides from there. The videos, even though they're pretty short, just do a quick intro for them. Probably won't rewatch the video unless someone really wants to, that's part of your presentation, then we watch the video. It's not a big deal. They're pretty short, but at least to do a quick little intro of what the presentation's about or the video is about. All right. Are there any questions before we get started? It should be just a nice flow of slide 1 through 40, and then we'll get you guys out of here. Any questions? You guys are gonna do great, just like last week. It flowed really well last week. I really enjoyed it. All right. I'm gonna shut up, and when the first slide comes up, group 1, it's your guys' show.
All right, so I just want to thank everyone for being here today. We're going to talk about fentanyl here in Arizona. We're going to talk about how we can come together to take action for not only our community, but our kids. We're seeing a spike in overdose and overdose-related deaths of fentanyl. Next slide. So here we have a couple of article clippings. There's no doubt that fentanyl is here in Arizona. Thousands of counterfeit pills are being confiscated by police all over the state, and these contain potentially deadly amounts of fentanyl. Fentanyl and counterfeit pills can be found across our state and in any community, big or small. All right, next slide. Go ahead, Tiffany. Or Jennifer, sorry. Okay. Okay, so fentanyl, it has deadly consequences. The Arizona Pediatric Fatality Review Report for 2020, it found that 95% of these overdose deaths in children under 17 were caused by a fentanyl poisoning. That's 60 children, 17 and under, died from opioids. Of those 60, 57 of them were fentanyl poisoning. All right, next slide. So here we just have a short, then hear the story of one family that's been affected by fentanyl.
I don't think there was sound for this video, or unless not on my end.
Yeah, I'm not hearing.
Nope, you're right. Yeah, nope, I forgot to hit the button. That's my fault.
All right. So today we're going to talk about the 3 aspects of this issue. Take a look at what fentanyl is to provide you a better understanding of what the substance is. Then we're going to talk about how big this problem is and what is driving this problem. And lastly, what can we do as a family member, as a member of the community? It's important that we all work together to save lives.
So fentanyl opiate, and an opiate is a class of drugs that's used to reduce pain. They're prescribed by doctors to treat moderate to severe pain, anything from maybe dental surgery all the way up to other surgeries. Patients with cancer use opiates, things like that. And there's different examples of opiates. We have oxycodone, also known as Oxycontin, hydrocodone, which is also known as the brand name Vicodin. And there's also fentanyl, morphine, and methadone. So what we're seeing on the streets right now is what's called illegal fentanyl, which it's synthetic, it's man-made. It's 50 to 100 times more powerful than heroin and morphine. So it's illegally sold for its heroin-like effects, often pressed into counterfeit pills. The one that's pretty popular right now is the blue M30, which it looks like a 30 milligram of oxycodone, but unfortunately it has fentanyl mixed in with it. And people are taking it and they don't know that it's mixed in it. And then we have heroin, which is an illegal opiate. Heroin comes in the form of black tar heroin. Oh, sorry, I missed the slide. So as you can see on the slide, just a little bit of fentanyl is all it takes for a person to overdose. We see the penny here, and then we see these few grams of fentanyl. This is all it takes to kill a person. Sorry guys, I'm trying to go off mine and it's not, it's acting weird. So heroin, like I said, heroin is an illegal opiate. Heroin comes in form as black tar powder, black tar heroin. So what does fentanyl look like? Prescription fentanyl can come in either patches. It can come in a vial, as you see. It's given usually in IV form when you come out of surgery, and it can also come in pill form. Illegal fentanyl is on the right, and as you can see, it can come in powder form, and it can be masked as the blue M30s here on the bottom right-hand side. On the top left-hand side, we have the green 80, which is an Oxycontin, and then at the bottom, there's that M367 pill. I believe that's a Vicodin pill. These can all have illegal fentanyl in them. I think that's it, right?
Okay, we are up next. So I'll start with this slide. The most common form of legal fentanyl is in pill form. These are some examples of the illegally produced counterfeit pills that contain fentanyl. They're designed to mimic legal prescription medication like Xanax or oxycodone, but they have none of the properties of the legal drug. These are counterfeit pills that contain fentanyl. Most of the pills found by law enforcement are blue with M30 stamped on them. A new trend we are seeing, however, is that small pills are now being made in different colors. The pastel M30s on the right there, or the brightly colored M30s, still have the M30 stamped on them, but they come in several different colors. One thing to keep in mind here is that when these counterfeit pills are being illegally made, the person making the pill has no idea how much fentanyl is in each pill. It's kind of like making chocolate chip cookies. Some cookies have more chocolate chips than others. In this case, some of the pills may have a lot more fentanyl than others, but the person using the pill would have no idea if the pill they're taking has a lot or a little amount of fentanyl. keeping in mind it only takes a little fentanyl to overdose. So there's ever-evolving slang names that are used to talk about counterfeit pills laced with fentanyl. Some of the current most common ones include M30, represented by a blue circle with a white M that looks similar to a blue M&M. They also are referred to as blues. And then in this box here, there are additional street names for illegal fentanyl. If you see any of these names in social media or text, it may be a cause for discussion and action. Again, these aren't all the street names, but some of the most common ones. So fentanyl is found in substances that are used in a number of different ways. They can be swallowed, snorted, in which the pills are crushed into a powder and inhaled through the nose. They can be smoked. The pills are crushed, then commonly placed on tinfoil and smoked. A telltale sign of someone smoking counterfeit pills is if you find small pieces of tinfoil around the house, in their car, or in pant pockets or clothing. And then the pills can also be crushed, heated, and injected into the arm.
Okay, I guess I'll do 11 to 14. Sorry, Jason, I just saw the message. So how big is this problem? We see it more often in Arizona and many of our communities. And we know that fentanyl is the #1 substance found in fatal overdoses. And we see it a lot in our youth during this time. And why is this occurring? We know that the counterfeit pill seizures have been increasing, especially in 2021. And we see an increase in all these pills that have been counterfeit seizures in our community. And we know that 100%, there's been 100% increase in counterfeit pill seizures in 2021.
What we have learned is that you can't differentiate between a counterfeit knockoff pill and a real M30 pill. So you can't, so we want people to know, don't be faked out. The pills that are sold on the streets or online contain contain the deadly substance fentanyl. And what we also know is that what they're getting primarily through Snapchat, the likelihood is that the oxycodone, the Percocets, often known as perks, those are fake, and the likelihood of them containing fentanyl, including a deadly dose of fentanyl, is extremely high. So we really need to stress that to our youth, that there is no safe pill. Next slide. And this is, there we go.
So when we look at what's driving substance use, especially when it comes to youth, there are three things to take a look at: curiosity, stress relief, and dependence. Curiosity is something that youth have just being adolescents themselves, right? And sometimes they're wondering, what does it feel like to be able to feel high? Why are my friends doing this? Maybe I'll enjoy it also. So just curiosity in general. Then there's also stress relief. Sometimes us adults forget that our teens are dealing with stress and having to handle stress, from school to family issues to dealing with their peers. And they can become extremely overwhelmed and want to relieve that stress. And so they begin to possibly self-medicate, thinking that particular substances will help them navigate and deal with those challenges in their life. And then finally, if we look at dependence, sometimes youth can get involved with substances, possibly because they were prescribed a medication due to an injury of some sort, through sports, and then they become dependent upon that substance because they don't like feeling pain or whatever it may be. And so when you take a look at these three things combined, it definitely can increase the likelihood that youth are going to want to use substances. Next slide. So what do you want to take a look at when looking and working with your young person in your life and wondering, okay, what's going to increase the likelihood of them using? And so one of the things that you may want to pay attention to is family history of substance use. When you look at family history of substance use, you want to be thinking about what are the things that have been occurring in your family's life, as far as, are there people who have been and or are addicted to substances? Are there family members who have been challenged in life with using substances? And so when you look at that, also genetically, if it's something within your family that's within your genes, to be aware of and educate your young person about. The other thing that we want to take a look at is if there's diagnosed or undiagnosed mental health issues. Sometimes our youth, are going through challenges of depression, anxiety, maybe ADHD, and that may be diagnosed or undiagnosed, these mental health issues. And so if you are aware that they have a diagnosis of this, again, you want to just be aware. But then also you want to pay attention to if they are exhibiting these behaviors as far as depression, anxiety, ADHD, that's just, again, another indicator that might preclude an individual for maybe being at higher risk for use. Another thing that we want to consider is traumatic events. When we think about traumatic events, I know that we throw this word around a lot, especially in our world today. And a lot of times people don't understand what a traumatic event is. I can spend a lot of time speaking on this, a whole workshop itself. But when we think about traumatic events, when we think about big traumatic events, those are things like natural disasters, such as tornadoes, hurricanes, fires, or floods, sexual assault, physical assault, maybe witnessing a shooting or a stabbing, a sudden death of a parent or trusted caregiver, maybe if they've had some physical pain or injury. So those are examples of some traumatic events that may have occurred in your young person's life that could impact them and want to lean them towards possible use. And finally, it's impulse control difficulties. If an individual or young person has challenges with controlling their impulses and just seem to react a lot of times pretty quickly in certain situations, even if they're just having fun. When you combine all four of these together, you increase the risk for substance use. And so the more that you add on to these building blocks, again, the more increase that there is for use. Next slide.
We're giving you guys a lot of information today about statistics and different things going on in Arizona. And sometimes that can feel overwhelming, but we also want to give you guys some tools to put in your tool belt of what we can all do to help with this fentanyl crisis we've seen. So the more tools we have, the better, because education is power. So we can try to prevent fentanyl use before maybe our young person or family member or whoever it is even decides to go down that road. So prevention, healthy choices. Maybe we're making a rule in our home, no drug use. We're really working on the prevention side, putting in those healthy mindset tools, diet, all of that thing. We're creating a healthy environment to kind of decrease that stress and other things that we've seen in the previous slides that can lead to that. Screening and intervention. We can see who the people are that maybe are in need of extra help, extra support, and we can take action to help those people. Overdose and there's also overdose prevention. Naloxone is amazing, an amazing resource that is saving hundreds and thousands of lives. and it's available for free from a lot of distributors. If you do not have it, we can help you get it. It's safe to carry. It should be in everyone's first aid kit. And to also find help. Treatment works. There's a reason that we have rehab centers. Treatment works. Recovery is possible. And to share that message of hope with those who are experiencing this epidemic. Next slide. And we're going to go into learning what parents and caregivers can also do for their youth. Next slide. That was the end of our group. I don't know who's next.
That's me. So we want to make sure we're talking early and often with our kids. So we do want to make sure we're offering them advice and guidance. We don't want to come off as if we're talking to them. We also want to be able to open up that conversation to try and understand their point of view and show concern of where they're coming from, rather than coming off maybe as angry. And the reason is for that is because we kind of want to build up a safe place for them to come to us, because they will experience situations where even maybe if they don't want to, they will be exposed to this. And we want to kind of help to navigate them through that and really create that safe space so we can help to establish a rescue plan for when they are in that situation. They know they can come to us and we can help them to get out of that. Can I have the next slide, please? Thank you. So the second part of that, to just kind of make sure we're involved in helping them to navigate through it, is of course monitoring their social media. We always want to make note of what social media sites they're on, which ones they're favoring, where they're visiting often. And of course, we want to make sure we're tracking how often they're on that and set limits to that. You, of course, are paying for their phone bill, so you do have every right to get involved and be involved so that we can help them to get through that. Boundaries are a really nice way to help them through that and understand where you're coming from and like what's a good limit for them. And so another really good resource we have is that we can help you to get set up with a technology contract. And that's a really good option for us to help them with that too.
All right, you might want to do all you can do to help your kids avoid substances. But when you take them to the emergency room or to the dentist to have work done, they can get prescribed medication. You can ask the doctor for some other some non-opioid medications, like using Motrin, Tylenol. You know, you can get a shot for local where you need a doctor, or other alternatives such as acupuncture, physical therapy, or massage are some good choices to do. You want to communicate your concern to the medical professional, and don't be afraid to speak up on behalf of your team. All right, next slide, please. All right. Please know that abuse of prescription medications is also still occurring with our youth. Make sure to store your prescribed medications in a secure location, you know, up high so little kids can't reach them and stuff. You can use lock boxes and stuff. If you have medication in your home that you're no longer using, there are many locations throughout the state to drop off those unused and expired medications. You can just drop them off and walk away. Local coalitions and stuff usually will have little drop places for your medications throughout the state of Arizona. All right. Bob, you ready?
Sorry, I was muted. Situation here with this slide is a young man that was in the Prescott area that had been in trouble in the past and been in and out of juvenile detention. and was out and was doing fairly good. However, took some Percocet and fentanyl. And this is a text message that they actually found when they were able to obtain the young man's phone and go back through the messages there through the fatality review team. And it gives us an opportunity to identify a gap that we may have in our community and then try to fill that gap so we don't lose any additional lives. But you can see the conversation that took place. Sad part is the individual on the other end of that conversation never called anyone, never reported it. Next slide, please. And this is one of the things we had heard is concerns that were out into the street is that law enforcement themselves really didn't know about the Good Samaritan Law. So what we did is we felt based upon that, who better could explain the Good Samaritan Law to our communities than a uniformed officer. We were very fortunate to have now retired Chief Debbie Black from Prescott go on camera and convey the message that it is so important to call 911 and that you will not get into trouble. You can skip through, Tommy. Is this one mine too yet?
Might be, sir.
Okay, then we'll run with it. A key factor for all of us is to know the signs of overdose. And one of the things I always ask the crowd is how many are CPR certified, which will help because an overdose will mimic a cardiac arrest, but also can indicate, it may just appear that individuals are sleeping. We've heard that from school officials where they thought kids were just dozing off in class, when in fact they have been actually overdosing on fentanyl. So you may see what they call as the opioid nod or a snoring sound that's coming from. You may see very slow, shallow, repressed breathing or no breathing at all. They will turn blue, ashen in color, both from the skin as well as their fingernails, or they may have clammy, sweaty skin. So the signs pretty much of a coronary are the first, but the biggest factor that we have to emphasize to everyone is, yes, you want to move forward with naloxone, but always, always, just like CPR, call 911 first and make sure help is on the way.
Okay, so now that we've discussed the signs of an overdose, let's talk a little bit about how naloxone works. So naloxone reverses an opioid overdose by restoring breathing and heart rate. So what kind of happens is in our brain, we have opioid receptor sites. So we're going to pretend on my hand here, my fingers are those sites. What happens when an individual is experiencing an overdose, those opioids go and they attach to those receptor sites. What naloxone does when administered is it comes in, it knocks those opioids off and it attaches to the receptor sites, allowing that person to breathe again. It's just really important to remember that even if naloxone is administered, like Bob said, to call 911, because what can happen is those opioids, once the naloxone wears off, those opioids can reattach to those receptor sites. Another thing really important to remember is naloxone is a life-saving tool. I know there's some stigma around it, but it does save lives. In anyone, the great thing about it is anyone can get naloxone. A prescription is not necessary. So if you go to naloxoneaz.com, you can actually find the nearest location where you can obtain naloxone. A lot of your community coalitions also are distribution sites through ADHS. So you can get a hold of those coalitions, a contact person, and no questions asked, receive naloxone. This next slide here, we're gonna watch a short video about John and how naloxone gave him a second chance at life.
Okay, so now we're going to talk about what you might notice in your child and the different steps that your child may be, or youth may be experiencing as they are using opioids or counterfeit pills. The first thing that happens is that their body develops tolerance. And so they have to use more and more of a drug to get the same high or the same feelings that they had the first time, second time, third time that they used that substance. So now they are developing a dependence. They don't get that good feeling when they use because their body has adjusted to having the excess in their system. So they have to keep building up, building up, building up. Stopping use, well then, as you notice this, and if you talk, pardon me? All right, I thought I heard someone speak up. So stopping the use, if you notice these things happening, or you are suspicious of something happening and you reach out for help, withdrawal will happen. So some things that you might notice in your youth as they experience withdrawal are physical symptoms. They can have muscle aches, they can be very restless and jittery, and they can start experiencing anxiety as well as nightmares and other symptoms. Physical symptoms can include diarrhea, cramping in their stomach, nausea and vomiting, a very rapid heartbeat, which you may not know about that they may be feeling, and high blood pressure, again, which you may not know about, but they will be presenting themselves if they are in a doctor's care as they go through withdrawal. Another thing that can happen with our youth is the emotional withdrawal, and this can last for months. They're losing their social group. The social group is who they are interacting with. It becomes very tight because they all are usually addicted to the same type of pill, of substance. And so as they're going through withdrawal and trying to get better, they lose their social group and they have to kind of start over building a new social group. This is very, very hard for them. And this can lead to a high risk of relapse. And so the same symptoms that you noticed when you realize that your youth may need some help using these opioids, you may notice that they're starting to have the same symptoms. And this is very common with our youth, or anyone actually, when they're going through these withdrawals, both physical and emotional. There's a very, very high risk because those symptoms come back. And this is something to watch for as you're helping our youth go through stopping this addiction that they have. Next slide.
If you discover that your child is using opioids or counterfeit pills, here are some steps that you can take. First, ensure safety. Have Narcan available at all times. Have your child evaluated by a professional. Suggest treatment. Listen to your child to determine the best course of action, and listen for change talk. Next slide, please.
How we're talking to our teenagers can make the biggest difference. When you're noticing how they're feeling, their grades are starting to fail, they're feeling depressed, you can go about saying, I know you've been saying that you want to get better at your grades. Is there something going on? Just the way that you communicate within your group of youth, whether that is your own youth or if you're working in the community with youth. When you start to build those relationships, you will start to see how they are being affected by things that are going on in their life. And if you're, well, what's going on? Why are you doing this? They're going to shut down to you. But if you come at them with a positive attitude and meet them where they're at and just communicate them with where they're at and have no judgment, they're going to open up to you. They're going to be able to talk to you. Next slide, please. Here is a good resource on where you can go for confidential hotline. That way you can speak to somebody regarding some of the stuff that you are struggling with. Next slide, please. Seek treatment options. Always ask questions. Always try to build a support community and take care of yourself. Take care of the people that you're helping and the ones that you're with. Next slide.
So you are your child's greatest advocate and champion. This site and these options are going to help you, and they're going to become your biggest supporter and your biggest advocate. So first we can start with how to get some help by text. Okay, so when you sign up for these text messages, you can get reminders to take care of yourself, because that's going to be important. You can't take care of somebody else until you get that self-care. They're going to send you life-saving information. They're going to give you strategies to help motivate you and your child, and they're going to give you some some support, some life support. So this is how you do it. If you text right over here, you can see text JOIN, JOIN, to the number 55753. Again, text JOIN to 55753. They're going to have you answer a series of questions specifically about your kid's substance use. And then you're going to receive support and specific instructions and information specific to your child's needs. You could also visit the Partnership to End Addictions website. It's called drugfree, all one word, lowercase.org. And you can get a ton of resources on this website to help you and to help your child. Next slide, please.
So today we've talked a lot about how you can support your kid. You know, this is a tough topic, and anybody that's going through this or has gone through it understands how emotionally and mentally taxing it is for the parents and caregivers. So I just want to talk a little bit about drugfree.org. They offer a peer-to-peer parent coaching support mentorship. So basically what that would entail is being paired with a specially trained volunteer who's also been in that same situation, traveling the path of substance use or addiction with their child. So speaking with someone who's been there can really be powerful for parents who are going through it for the first time. It just helps you to understand that you're not alone. The coaches are there to listen and offer ideas, and really just to encourage you and come alongside to support. So the coaching would take place on the phone. There's more information on the drugfree.org website. And we also have a flyer in the back for you. So grab one before you leave if you're interested.
An additional resource we have here in Arizona is naloxoneaz.com. Naloxone is one of the best first aid kit items you can have. Naloxone will overturn an overdose. You can go to naloxoneaz.com to find distributors near you. All you need to do is put in your zip code and it'll pop up places near you where naloxone is available. It's also not a prescription item, so you can get it from any pharmacy. There is cost associated if you get it from the pharmacy, but a lot of your coalitions, as well as county health departments here in Kingman, our Arizona Youth Partnership is a local distributor, as well as our MSTEP coalition. We provide trainings and also naloxone for free. So having naloxone on hand in your car, at home, at work, can potentially save a life. Next slide. Oh, maybe we lost one of our people. So there's
no, I'm sorry, I'm here.
In Arizona. Do you have it?
I'm sorry, I was on mute. So here's a list of our Arizona important resources. TalkNowArizona.com is a site that provides facts on fentanyl, how to talk to your child, and some great videos with tips and tools to start these important conversations with them. Again, naloxoneaz.com, which you saw on the previous slide, gives you locations to acquire this locally. Opioid.com also provides facts and dangers of opioids and provides you with contact information for helplines and everything. And then learnmoreaz.org is a research base, gives answers for you and your kiddos regarding questions you may have about drugs and alcohol. And then as you leave today, don't forget to scan the QR code on the table in the back. This will provide all the links to the local resources and a link to our own TempeCoalition.org, where you can learn more about our efforts within the community to reduce youth risk behaviors and more. And thank you for joining us today.
All right, great job, everyone. Hope you guys were able to, get something out of that. Obviously doing a little studying on your part, 15 to 20 minutes. But again, I thought everybody did a really good job. A few people kind of put their own little spin on things. You can tell some people have done this presentation before, and it definitely was definitely noticed for sure. So again, are there any questions before we wrap everything up? Is everybody kind of understand the material? Is anything confusing to anybody? How the flow of it goes? All right, I don't hear anything or see anything in the chat, but again, no, I thought everybody did a great job. Again,
I have a question.
Yes, yes, sir. Yes, sir.
This is Jamal. How you doing?
Good, Jamal. How are you, sir?
Good, man. Question. You did the presentation, I thought really well and pretty succinct in 40 minutes. Is there a time frame that people, and what if people, when I'm, working with people in the community, what should I tell them? Is it an hour presentation, hour and a half? Is it 30 minutes? What's your all suggestion?
Yes, sir. As a matter of fact, that's actually a very, very good question. Myself and Ricky were actually having that conversation offline as you guys were studying. It could be what you have time for. And that's the thing, it's adaptable, right? If you have 30 minutes and you can go through the presentation and ensure that you take the good chunks out of the presentation. And if it's 30 minutes, it's 30 minutes, but you make sure you want to hit the key components of it, obviously the risks of it. And also, again, it's gonna be a little different in virtual land, right? You're just one person speaking the entire time. So I'm able to get through it for about 40 minutes. There's no back and forth conversation. If I was giving this presentation in person, I'd want almost an hour because I want to hear from the audience. I want that back and forth conversation. When I present, I like the conversation when I present. I want to call on people to kind of maybe hear some of their stories. So it could easily be an hour, right, Jamal? So to answer your question, it really is kind of what you have time for, as long as the content is getting the message is getting out there. If that answers your question. Yes, ma'am, Ivy.
Oh, I just want to remind you too, Jamal, to make sure you leave room for surveys. We want to make sure we get in those pre and post surveys as well. So
good point. And that does take a few minutes, and it's very important data to collect, sir. Yep.
Question regarding the pre and post surveys. So if we do that, through the QR code that might be attached to this particular presentation, how do we get the results of those?
we can get those through Shayna. So if you're wanting results, she can pull them for us.
Great, thank you.
You're welcome.
Thank you, Jamal. Great questions and great job on your slide. You nailed that slide. Thank you. Any other questions? Those two were really good questions to ask. Is any questions on maybe the Snapchat presentation? First off, then thank you, Sakazi, for putting this on. So we really appreciate that. I hope you guys are able to get some training out of it, an understanding out of it, and just come to experience kind of seeing some of the presentations given from different perspectives. Again, like I said, everybody has their own little flair when they do present. And that just kind of comes with reps, right? Just kind of getting in there, understanding it, and just going through the slides. I'm not sure if Shelly is still on. I wasn't sure if Shelly wanted to hop in and say a few things before we get off.
Hey there. No, I thought everybody did a great job. Thanks for leading it, Tommy, and your team, and getting everybody into the breakout rooms. And I think, Jamal, on your question too about the length of time, ideally, if you have that situation where you're at a PTO or PTA or something, ideally it's about an hour. Say, hey, it's from 6 to 7. But if you're like, the only way you can get in front of a PTO or PTA or school administrators are like, hey, you got 30 minutes, go ahead and take advantage of that time and, you know, and do the presentation. So, you know, even if you get in front of a Kiwanis or a Rotary and they're like 15 minutes, hit counterfeit pills laced with fentanyl, naloxone, and the Good Samaritan Law. So, and for those, you know, you can't count them in your count because you won't be able to do a pre and a post. So for your pre and your post that are able to be counted in the count, you want to do the full presentation because the survey, the pre and the post are designed from that full presentation. And if you give a shorter version of it, you may not be covering the material that needs to be covered in the pre-post. So ideally, the whole presentation, about an hour, you may end earlier, and then also customizable to be shortened, you know, if you need to. Hope that helps.
No, it definitely does. Thank you.
Thank you, Shelley.
You bet.
Again, I want to thank everybody for hopping on, participating. I know you guys' time is precious when it comes to, you know, doing the work you guys are doing. So hopping on for a couple hours, we really appreciate it. Again, thank you, Sakwa Z. Thank you, Shelley, for putting on this training. You know, from speaking from our team, we couldn't be happier. The partnerships that we have, from Counter Drug down to you guys. It was just seeing firsthand a lot of the work you guys are doing. It's phenomenal. And again, happy to put on for more training. So if there are other trainings as you're curious about, please let us know and we can try to get something like this set up again.
Hey, Tommy.
All right. Yes, sir.
Hey, just a real quick question. It's Tim Luntz. You guys were mentioning about the pre and post surveys, and I'm having trouble finding those on the Sakwa toolkit. Do you know where those are at?
I already had those locations for those.
Yes, they'll be under the toolkit under the fentanyl and counterfeit pills. If you scroll down to evaluation, it should be under the first folder for fentanyl.
There it is, found it. I just didn't see the eval folder. I was looking in where the videos and then the handouts and I missed that. Thank you, Heidi.
You're welcome.
Yeah, there's a lot of information there, Tim, a lot of good information all over that toolkit. So you can definitely get lost in there.
Yes, thank you.
Yes, sir. Again, thank you all for attending. We really appreciate it. And I hope everybody has a great day. All right. Thank you, guys.